I see people from all walks of life, including elite athletes, recreational athletes, manual laborers, elderly people enjoying post-retirement lifestyle. These people present with a wide range of musculoskeletal disorders. These include from chronic tendinopathies, ligamentous injuries, muscle injuries, meniscal injuries, even osteoarthritis. Here at KRIDA Harley Street, our emphasis is mainly on non-surgical management options for treating musculoskeletal disorders. We focus on activity modification, lifestyle modification, provide advice on pain medication to, as well as the offloading, advice on the rehabilitation. More importantly, we focus on injections to manage the pain and inflammation, injection to get sustained pain relief, and injections to achieve quick healing and disease modification. These are the treatments which allow patients to better from their symptoms, quick recovery, and get back to their activities in sports. I always put this option out as a first line. If patients coming in with non-mechanical symptoms such as instability, locking, giving away, alignment issues, these are the conditions which I would encourage them to go and have a consultation with the surgical colleagues of mine. However, if they don't have any non-mechanical symptoms, we would try to manage these with the non-surgical injections. These could be a simple inflamed soft tissue, inflammation of the bursa, inflammation of the tendon, or acute joint arthritic flare-up. Patients coming with a painful swollen joint, their pain levels are too high to even go for a short walks or struggling to sleep better. These are the conditions I would use the non-surgical options as a minimally invasive, quick recovery time, and to a degree to achieve a disease modification as a first line. We do offer a wide range of injectable. That is one of our specialization here at KRIDA Harley Street. One of the simplest injections, depending on what patients are coming in with. I always have this chat with the patients. If somebody coming in with an acute, a painful joint or a soft tissue, and they say, Suresh, I'm going away next week. I wanted to go and enjoy my holiday or my commitment. How can I achieve that in a short period, given short period of time we have? The one of the ways is achieving that would be a cortisone or a steroid injection. We perform ultrasound-guided steroid injections to achieve that quick pain relief, which might last only a short period, but that is what we are expecting from that injection. That is one of those very straightforward first line. Then we would go on to offer a hyaluronic acid, which is a viscose supplement, like a lubrication to the joint to get a sustained relief along with the steroid sometimes. The other injectables we use is the biologics. When I say biologics, using patients' own cells or blood plasma to help with a quicker recovery, naturally calming down the inflammation, and biggest advantage of these biologics are disease modification. What I mean by that, slow down the progression to a degree, pause the progression of the disease if you're treating the right patient with the early to moderate arthritis for the right reasons. This is one of the treatment options we offer. More recently, we've also been offering arthrosamide hydrogel injection for sustained pain relief for arthritic knee joints. So there are a wide range of injectables depending on the patient expectations, depending on their conditions, severity of the conditions. We have the detailed discussion to our patients and advise the right treatment option for them. Firstly, it's minimally invasive, less complication rate compared to the surgical, and quicker recovery. If we can achieve all of these as a first line, then this would be a sensible choice for our patients. We understand there are some conditions, especially the mechanical symptoms need to address surgically, or the alignment issues need to address surgically. But if the patient doesn't have all those alignment issues or the mechanical symptoms, we always encourage them to consider the non-surgical options. So the typical appointment here at KRIDA Harley Street, firstly, we don't need any referral. You can self-referral with any musculoskeletal conditions, painful joints, soft tissue. The typical appointment is where you come in, we perform an expert musculoskeletal consultation. That's followed by a diagnostic ultrasound scan. We can get most of the information we required from the diagnostic ultrasound scan, and that will allow us to diagnose your problem accurately. From there on, we will discuss the treatment options, predominantly the non-surgical management. And then if it's appropriate, we can perform that treatment, could be an injection at the same appointment. There are sometimes the surgery is not a solution or not an option for some patients. Those are the patients we can help in symptom management, i.e. reduce the pain and inflammation, get the better quality of life, allow them to do a bit more on their feet or involved in their activities such as gardening, walking, doing a hike, any such activities. First classic example, we had one sports person come in, she developed inflammation following a repetitive strain. That inflammation would get better over a period of time. For her, the main thing is she need to participate in the game coming week, and then we wanted to reduce that inflammation given that short period of time we have. Surgery is not an obvious option here, and she consulted the surgeon. They recommended to have a simple injection which can help with pain and get her back to the pitch in a short period of time. So that's the kind of conditions where we come in, we help, we diagnose, we scan, and we perform these injections using ultrasound guidance so that we place accurately these injections where we need to do the procedure. Especially the elderly people suffering with arthritis, that could be a hip arthritis, knee arthritis, ankle, foot and joints, or the shoulder, or even very focused patellofemoral arthritis, which can cause a significant problem, especially going up and down stairs. So these are the symptoms we could manage by injectables, from hyaluronic acid to the biologics, and more recently arthrosamide hydrogel, which is showing good results for especially patellofemoral arthritis. The treatments we offer allow you to postpone surgery, yes, to a degree. If you're coming to manage the symptoms, your disease are quite early to moderate, the treatment options, especially the biologics such as platelet-rich plasma, will allow you to manage the symptoms as well slow down the progression and delay the treatments. And there are people out there, for if they have complex medical history and they cannot have the surgery, and there's no reason for you to live in pain, live in disability. There are treatment options we offer here at KRIDA Harley Street, allow you to have a better quality of life, live with no pain or less pain, and enjoy the activities. There is no reason for you to suffer in pain. If you cannot have the surgery for whatever the medical reasons, there are these non-surgical options which will allow you to get some quality of life with a less pain, improve mobility. Yes, this is the misconception people have. All these biologics or the other injectables are for elite athletes or high-performing individuals. No, these treatments are available for all walks of life, as I mentioned. And then if you are a retired, 70-year-old struggling with arthritis, or you could be struggling with a simple frozen shoulder or a soft tissue or a plantar fasciitis or a carpal tunnel or low back pain. These are the conditions we can, with the right approach, the right diagnosis, with a multidisciplinary approach. Again, I would mention this. The injections are there to help with the pain and inflammation. These injection does not give you strength and stability. We always work with our colleagues who are follow up our patients to improve the strength and stability, rehabilitate appropriately so that you can sustain the relief and then also prevent it from recurrent episodes. Again, as we always say, you don't have to be a sports person to be treated like one.